Okay, a very good evening to one and all present here. I, Dr. Kumar Lalwani, on the behalf of Nationwide Quality of Care Network, welcome you to today's COP session. Now, on the City-to-City COVID-19 Vaccination Learning Exchange initiative, a USAID-supported and PSI-led knowledge platform to facilitate sharing and learning on COVID-19 vaccination between 15 cities from the Global South by Dr. Ajit Sudke. Now, I would like to call upon Professor Vikram Datta. Professor Vikram Datta is the Director Professor, Department of Neonatology, Lady Hardinge Medical College, New Delhi, India. He is a President at Nationwide Quality of Care Network and Vice President at National Neonatology Forum, India. He is a guest editor at BMJ Open Quality Journal. He is a member of editorial board of International Journal for Quality in Healthcare Communication. He is expert at the International Society for Quality in Healthcare. He is a lead at National Mentoring Group and Technical Resource Group. He is a lead at Sustainable Model for Lakshya by Ministry of Health and Family Welfare, India. He is a member of QED Working Group at Ministry of Health and Family Welfare, India. Sir, I would like to invite you and request you to welcome Dr. Ajit Sudke for today's COP session.
Thank you so much, Dr. Komal. Good evening, friends. And I welcome all of you to this Communities of Practice session this evening. And thank all of you for sparing time on a busy working day. I'm sure most of you would have just got back from office Indian Standard Time. And I thank, and it is a privilege to introduce my close friend and associate, Dr. Ajit Kumar Sudke. Friends, as all of you know, Dr. Ajit Sudke needs no introduction to NQOCN, and we consider him a part of the NQOCN, being on the board of the BMJ Open Quality as an associate editor. Dr. Sudke is an accomplished pediatrician and a neonatologist, working in the field of public health for many decades. Currently, he is leading the prestigious technical hub in a USAID-funded urban health project, which is led by PSI International in 6 cities of India. As I just mentioned, he is working very closely with our team at the BMJ Open Quality in capacity as an associate editor for the South Asia edition of the journal. He has had a wide experience of supporting various health systems, strengthening projects and transforming projects across diverse geographies in India, in states like Maharashtra, Bihar, Uttar Pradesh, Jharkhand, Himachal Pradesh, etc. He's experienced in developing and monitoring grants focused on improving quality of care in MNCH in both public and private sector, and has piloted multiple innovations and has got multiple awards to his credit. He has worked in multiple UN organizations, notably amongst them being UNICEF, WHO, and global donor organizations, including the Gates Foundation and the Children's Investment Fund Foundation, as well as international NGOs like Piramal Swast and Access Health International. So I have the privilege of inviting Dr. Ajit Kumar Sudke. Sir, the floor is all yours, and we would like to learn about the experience sharing platform across 15 cities of the Global South on COVID vaccination and your experience of the same. And this will be followed by a question and answer session. And let me just mention here for the participants that all the questions may kindly be posted in the Q&A session section link, which is there along with your names. And we will be posing all of these questions and even giving you a chance to unmute yourself and ask the questions directly to Dr. Sudke at the conclusion of this session. So over to you, Dr. Sudke. The screen is all yours.
Thank you. Thank you, Dr. Vikram. And it's a real privilege to be invited to share the learnings from CoVLEx, the work which we are trying to do under the Urban Health Project Samagra, which is funded by USAID. And it's always been a pleasure to work closely with the NQOCN team. It's been, I think, now more than three years that I have been closely associated with the amazing work which NQOCN is doing. I would request Komal to please share the slide deck, and then I can take you through what we are trying to do under Samagra. So friends, as mentioned by Dr. Vikram, we had received a small grant within Samagra to actually create a knowledge sharing platform on COVID vaccination. And this, as he had mentioned in my introduction, that the urban health project which we are currently working on focuses on in 6 cities currently, and our plan is to move to 50 cities by the end of the project in 2025. But the scope of this particular initiative was beyond these the cities in India. So we started with the 5 cities in India where we had been working on supporting the local administration on COVID-19 related response. And then when the vaccination started on COVID-19 vaccination as well. So as we all are aware, that vaccination remains a core intervention for controlling the pandemic. And India has really played a very critical role under the Vaccine Maitri initiative. And we all believe in Vasudhaiva Kutumbakam. So I think India has really risen up to the occasion and has supplied vaccines to more than 98 countries. So PSI, with the support of partners through this particular initiative, aims to build a knowledge management system, which has been envisioned by USAID, which could help shape the discourse on the pandemic response. So as I mentioned, under this initiative, we have 5 Indian cities, which includes our capital, Delhi, then Mumbai, Ahmedabad, Indore, and Bhubaneswar. And we have matched these cities 1:2 with 10 other cities from the global south, mainly from Asia and Africa. And this was just for a very short duration of around between April to this year's April, where we are going to share the learnings between these different cities. And as you all are aware, that India has crossed 180 crore doses of vaccines which have been administered, and we are really proud of this particular achievement. Next. So what are the objectives? And by the way, the CoVLEx is the short the short form for COVID Vaccination Learning Exchange. So that is why we actually converted into CoVLEx. So the objectives were to basically engage with various stakeholders. As we all know that both the public and private sector, as well as donors and academicians or academia, has played a very critical role in COVID vaccination. And so our objective was to engage with all these different stakeholders, curate evidences which have gone into developing the vaccines as well as into rolling out the COVID-19 vaccination, develop knowledge tools and products, and then disseminate whatever we have learned through these learning exchanges. And the key result areas which we are looking at is come up with these knowledge products in the form of case studies, video stories, training material, planning, monitoring tools, create a digital repository of these knowledge products which stakeholders can have access to, and then organize regular learning workshops or webinars between these cities where the representatives from both public private sector can come and share their experiences and also learn from each other. Next. So it was quite a big task to really identify the cities where USAID also helped us. And we try to have some key criteria in order to identify and match these cities outside of India with the Indian cities. So we try to look at the socio-demographic indicators like population density, literacy, GDP per capita, etc. And another important consideration was the status of the COVID-19 cases in these different countries and cities, and also the rollout of vaccination as well. And because this was going to be sort of a remote engagement, we wanted to make sure that these countries and cities have a strong PSI or a USAID presence. So what we did was that we have these 6 cities from the African region, and then we have 4 cities from Asia, and we match them like it's shown here. So Delhi is matched with Hanoi, Vietnam, and Nairobi in Kenya. Similarly, Mumbai is matched with Dhaka and Kampala, Bhubaneswar with Phnom Penh and Cape Town, Indore with Lilongwe and Biratnagar in Nepal, and Ahmedabad with Addis Ababa, Ethiopia, and Abuja, Nigeria. Next. Right. So what we did was, you can play the video, Komal. So we were actively tracking on how countries were actually moving forward with the COVID vaccination program. So we used our world in data to actually track the progress on COVID vaccination in these 11 countries, including India. So city level data, like for example, in India, we have CoVIN, where we have the district level data, but for other countries, it was quite difficult to really get the city level data. And so we compared countries to countries. And as you see here, the share of people who received at least one dose. So Cambodia was actually leading since the beginning in terms of the share of people who received at least one dose. And then Vietnam also closely followed. India was doing pretty well. And then you can see that the countries from the African region were actually lagging quite behind when it comes to the share of people who received at least one dose. And as of March 9th, 2022, we find that Cambodia has now reached more than 85% of their population. Vietnam is close by, and India is again really done well. And we have Bangladesh and Nepal also close by. But if you see, the African countries all are below 40%. And for example, in Nigeria, Malawi, they are around 10% now. So we understand the challenges in vaccine equity through this particular slide. We can go to the next slide, Komal. No, this is the same one. You can click next and we go to the next slide. So yeah, we also looked at the share of people who completed the initial COVID-19 vaccination protocol as prescribed, divided by the population of the country. And here again, you'll find that Cambodia has again done pretty well, and India was also following up closely here. And so here again, we find that Cambodia is really quite far off as compared to the other countries. All the countries are like below 30%. So completing the initial vaccination protocol, by that we actually mean all the doses prescribed in the vaccination campaign for that particular country. So it actually, for India, it means people with 2 doses of the COVID-19 vaccine taken. So as you all are aware, we are reaching 60% in terms of people who have taken both the doses of vaccine. And again, similar to the first dose, Cambodia, Vietnam lead, and then Nepal and Bangladesh are very closely again with India. And here again, what we find is that when it comes to completing the COVID-19 vaccination protocol, countries within the African region really lag behind a lot. And so, as we all know, that unless everyone is protected, no one is actually protected. And so, how do we really address this vaccine equity gap and ensure that the countries in the African region also get the required doses of vaccines, and that too very quickly? Next, Kumar. This is another very interesting indicator. You can play the this thing, Komal. So where we actually talk about the booster doses per 100 people which have been taken, and there's also another indicator. So as you all are aware, the booster doses actually came up quite late, and again here Cambodia started the COVID booster doses. It was amongst the first countries to actually start that. And so we find that somewhere around globally around towards end of June, the booster doses started. And then, as I mentioned, Cambodia once again took a lead, and they have nearly completed the protocols as per their country policy. Majority of the people have actually got it. And when it comes to booster doses, the data also here is quite patchy in terms of actually getting those doses here. So we find that we have inadequate data for this particular indicator. But globally, again, you find that the booster doses are somewhere around 18%, and Vietnam and Cambodia are far ahead of the other countries. Next, Kumar. Yeah. So this indicator is again which we were tracking since the very beginning on administered per 100 people, and we also have this for our Indian cities as well. And so here So when it comes to per 100 people, I think India has done pretty well on this particular indicator. And as usual, Cambodia has been the leader when we compare these 11 countries. So these were some of the critical indicators which we tracked under this particular initiative to really understand how the different countries are performing. And then looking at this macro level picture, then we tried to go at a granular level to really understand what are the different things which the different countries have tried to do in order to address the challenges, what are their problems, and how have they really been able to address those. So we find here that Cambodia, Vietnam are again leading, and again India also has more than 100 doses administered per 100 people. But again, we find that the countries in the African continent still lag behind. So next, Komal. So as I said, that thanks to CoVLEx that we have this data for the districts, and though we would really have to work on getting city-specific data, but since majority of the cities where we are working, majority of the population, like for example, Khurda, Bhubaneswar actually comes under district Khurda, but around 80% of Khurda's population is urban. And so similarly, if we see here, we have the percentage of population fully vaccinated on the x-axis. Then we have on the y-axis, we have at least one dose people vaccinated, percentage of population administered. So there we find that Delhi is actually leading in terms of the population, percentage of population fully vaccinated, and also at least one dose. The size of the bubble actually shows the number of doses administered per 100%. So majority of the cities are doing pretty well. When we look at India, so around 60% of the population is now fully vaccinated in India, and at least one dose again is around 65%, and there are 131 doses administered per 100%. So in these 5 cities where we are focused under the CoVLEx initiative, we find that majority of the cities are doing pretty well. Next. So what we did was that in order to have these learning exchanges and to really understand what exactly the countries and cities are doing, we identified these 10 themes around which we decided to have learning exchanges. So so the themes included vaccine procurement, innovations, supply chains, communication, social mobilization, AEFIs, governance, planning, capacity building, and monitoring, supervision, and also taking these learnings of COVID vaccination into routine immunization. So we followed these themes and we built our learning exchange sessions around these themes. Next, Kumar. So to just give you briefly what are the major events which have happened in the sessions, I'll quickly take you through that. So this project was officially launched on September 17th, which also happened to be our Honorable Prime Minister's birthday. And we were really privileged to have Dr. VK Paul sir from Niti Aayog, and also Dr. Manohar Agnani from the Ministry of Health, and we also Veena Reddy, Mrs. Veena Reddy from USAID India, participate in the launch event of the CoVLEx initiative. We had the participation of more than 150 participants, and we were also really fortunate to have representatives from our own Ministry of External Affairs, as well as we had participation of government people from other countries as well, who are part of this particular event. And this also got a lot of media attention as well. Now, till date, we have completed 5 learning exchange sessions on 7 themes. The 6th session was around the private sector, role of private sector in COVID-19 vaccination. We can go to the next slide. So the first session was around communications and social mobilization for COVID-19 vaccination. So as we all know that vaccine hesitancy was quite a big problem initially. Now, probably we really don't have any vaccine hesitancy. There's more vaccine confidence, which you've seen now. But it was really interesting to understand how different countries tried to address this particular challenge in very, very unique ways. And also, like we tried to find out the reasons, which included some myths, religious reasons, personal beliefs, and all that, which were pretty common between these the different 11 countries. Also, each country had developed very robust communication strategies and techniques. And then it was very important that the community was engaged and the key stakeholders were involved. Like, for example, in India, I think we had all the professional organizations, we had religious leaders come in, and everybody really came together, including our partners. UNICEF played a very important role in supporting the government on developing the communications and social mobilization strategy for COVID-19 vaccination. So here we looked at specific examples from Ahmedabad and also from Abuja. Unfortunately, Addis Ababa, though it was a part of this particular learning session, they could not share their best practices in this particular session. Next. So the second session was focused on governance for COVID-19 vaccination, and we were privileged to have Dr. NK Arora, who you all are aware is a member of, he's the chairman of the National Technical Advisory Group on immunizations, and he's also a member of the NEGVAC, which has been set up for COVID vaccination. So he really took us through how the country really worked, including ICMR and the different, the Ministry of Health and others, on ensuring that the introduction of COVID-19 vaccinations really happens very smoothly. And I think India was really fortunate that there was the highest level of political and administrative ownership and commitment for this particular, for COVID vaccination. Also, and here we had Biratnagar from Nepal, Lilongwe and Indore participate in this, and each of the cities also shared how the governance structures at the state and city level were constituted, how they went about planning, resource mobilization, and the different implementation efforts, as well as the innovative methods which they actually brought in to improve the governance for COVID-19 vaccination. So this again was a very interesting session, and we had Mr. Mobuto Thomas and also Dr. Boston Zimba from Malawi actually speak on how their government really did this particular work. Also, Sagar Dahal from Nepal was a part of the government system. So I think one of the plus points was that we really got traction and a lot of interest generated in these countries to actually come and share their learning experiences with the other countries outside. So I think this, so CoVLEx provided that particular platform for the countries to come forward and present their learnings and also learn from others. Next. The third session was again around vaccine procurement and supply chain. So here again, we were really thankful to WHO as well as UNICEF to really help us understand on how exactly partners really work closely with the government to strengthen supply chains. Also, I think we had partners from IP Global, so where they were working with the private sector, and they shared how they were working on procurement of vaccines, the logistics management, and all that as well. Delhi shared the experience. So we had both we had Dr. Manjulata Sharma from Delhi sharing her experience, and then Vietnam and Kenya also shared their experiences here. And private sector had played a very critical role here. And so we had Jaya Raizada from the COVID Action Collaborative, another which has, I think, more than 100 implementing partners who are working closely on ensuring that COVID vaccines reaches to the most vulnerable population. We also had Dr. Satyabrat Rautre from PATH also sharing how they were working on supply chains strengthening, which was again applicable for COVID-19 vaccine as well. Next. The fourth learning session was around planning management and capacity building. And we had Dr. Yonet Thomas, who's the founder and CEO of Urban Health 360 as one of the co-moderators with us. And here again, we had experience sharing from Bangladesh, from Uganda, as well as from our very own Mumbai. We had Dr. Sachin Revaria from WHO, who presented how WHO is supporting the government of India and also at the state level on planning management and capacity building. These were very interesting sessions on how the different countries really worked on this, how they actually brought in, for example, lessons from the accelerated mass vaccination campaign, which happened in Kampala, the 360 degrees awareness program in Dhaka. There was also a door-to-door vaccination like we had in India as well, dedicated CVCs for vulnerable populations as well. So all these learnings were actually exchanged in this particular session. Next. Similarly, we had a very interesting AEFI session where we had Dr. Rajiv Das Gupta and Deepak Palkopara from ITSU. And then we had Dr. Vineet Goyal from WHO talk about how India is tried to address the AFI surveillance and how the learnings from COVID vaccination can really be used for strengthening AFI surveillance for routine vaccination as well. Again, technology played a very important role here. So our very own SafeVac was shared by Dr. Vineet Goyal on how it was used. Similarly, South Africa shared how the Med Safety app was used and how they use the stop QR code in Cambodia to actually work around the AFIs. Next. So these are some of the pictures from our sessions. We also had Dr. Rashankar Ghosh in some of the important sessions actually share his experience being one of the well-known figures in vaccination in India. Next. So this was the sixth session which we had the private sector engagement workshop, where we actually looped in Express Healthcare to help us organize this particular event. And here again we had Dr. Ram Sevak Sharma from NHA speak. We again had Dr. NK Arora, and then we had a beautiful panel of speakers. Also, the talk, Dr. Ted Prusek, who is the Senior Vice President at Temptime, he really spoke about the role of VVM. Unfortunately, we have seen that there is no vaccine vial monitor on COVID vaccines, and how this was a challenge and how it all went forward. Some of you would be following Mr. Devesh Jha, so who has actually introduced drones for supplying of vaccines in hard to reach areas as well. And we had a very interesting session. We had Dr. Harish Iyer, who's the Deputy Director, Digital and Health Innovations from the Gates Foundation, who's worked very closely with Serum Institute of India and with Bharat Biotech in ensuring that India actually comes up with our very own vaccines to address this. And when we had also Mr. Morena Makhona, who's the CEO of BioVac, one of the only manufacturers in the African continent. So probably you all are aware that the African continent only produces 1% of the vaccines which are actually required there, and 99% vaccines are actually imported in Africa. So what were the challenges which they faced? So this was quite an interesting session, and we will soon make the recording also available, and you all can visit it and actually listen to that. So this was a very interesting session which we organized, which clearly brought out the role of the private sector. Also, as a part of our activities, research is something which we are trying to do. POP Council is our partner for doing the research related activities. Next. So what we are doing is that to assess what are the best practices in COVID-19 vaccination in the 5 Indian cities and 2 international cities, which includes Nairobi and Biratnagar. We are actually conducting in-depth interviews of different stakeholders, including all the supply side as well as on the demand side. We've also visited the COVID vaccination centers, the ILRs and all that. And we would soon be coming up with a very interesting report on what were the observations in these different cities and how they've actually went about conducting this mammoth exercise of vaccinating the people in their cities. So we've completed the data collection in the 5 Indian cities, and in Biratnagar, Kenya would be started very soon. And probably by end of April, we would be ready with this interesting report. Next. So these are some of the pictures which we've taken from the field. So we had this entire team go there, interact with them, get these beautiful pictures, talk to the beneficiaries as well. So I'm sure you all will enjoy going through this particular report once it's available. Next. Communications has been one of our important activities related to this. Next. So my colleague Anshul, Sabine have been closely working on this. So in order to bring visibility to this learning exchange initiative and to showcase this, our audience was the different national and state governments in India as well as outside, and also the NGOs, the private sector, academia, public health enthusiasts, and we have our own social media handles as well, including LinkedIn, Twitter, and Facebook. And so I would request all of you to follow us on these channels and get the most recent updates on what is happening across these the countries in the global south as well. Next. So like for example, our journey so far, so we've used video formats for case study storytelling, infographics, milestones. We also have these red letter days where we try to highlight that particular day and then come up with op-eds, case studies, project impact infographics from the 5 cities. We also have shared video testimonials from the beneficiaries as well. And we retweet, we engage with our partners as well. So under Samagra, we have around 8-9 partners now working on the ground. So the amazing work which they try to do on under urban health and also in supporting the COVID-19 vaccination, they actually bring it to us and we try to amplify it through our social media channels as well. Next. So these are some of the glimpses which we've tried to share. So for example, the testimonials, the speaker post, which we try to put there, and also celebrating some of the major events like Republic Day and others as well. Next. These are again some of the testimonials on like Hoa from our Vietnam office on why she actually got herself vaccinated. So bringing out these stories as well, which people really like to follow. Also coming up with some question and some polls on LinkedIn as well as on Facebook, and also looking at the storytelling angle as well. And we have SPAG Asia, which has been supporting us in this particular work. And Anchal has been leading this along with Azra and team. Next. So these are some of our impact numbers. So we found that around 13.7% increase in the profile visits, some more than 5,000 odd tweet impressions, and in February around 5.4K impressions we had received. And so like some of the tweets are really very informative, which people really like, and then they reshare. So this is something which we are trying to do. The video storytelling and events also are actually, and we thank SPAG Asia for actually helping us in looking at these numbers as well. Next. So these are some of the communication activities which we've tried to do. We come up with newsletters, case study videos, and case studies as well. So I think this is something which people really like to really read on how Samagra really supported in addressing vaccine hesitancy in the outskirts of Delhi. Also, we publish our quarterly newsletters, which are developed and posted on the social media as well. Next. These are some of the knowledge tools I would urge you. So we are very soon coming up with our web page where we would post all these, and you can go and visit these and read these as well. So we have the event reports, we have the city profiles, so that you get a glimpse of what's happening there on COVID vaccination. Next. As I had mentioned initially that we are going to come up with these tools. So the newsletter, the CoVLEx fact card, monthly updates on what is happening on COVID vaccination across these the other 10 countries from the global south. Next. These are the different stakeholders from the different countries which we regularly engage with. Next. And yeah, thanks to USAID for being there with us, for having faith in us and to develop this particular initiative. We are also thankful to the Ministry of Health for regularly supporting us in the CoVLEx initiative. We are just managing this, and it's all thanks to our amazing partners who are always there to help us and be a part of the learning sessions, including WHO, UNICEF, PATH, the Bill and Melinda Gates Foundation, all our POCs from the different countries as well. Next. These are our implementing partners in the different cities in India. C3 in Bhubaneswar, we have Sneha in Mumbai, then WHP both in Ahmedabad as well as in Delhi. Then we also have Mamta in Delhi and PSI India in Indore. Next. So yeah, I would like to draw your attention. So while it looks very, very nice that we've been trying to do this, we had our own set of challenges. And I think probably NQOCN would also probably be able to relate with this, given that they're also working in South Asia, trying to engage with different countries as well. So connecting and getting relevant stakeholders on board from the global South had been a challenge. Also, like, how do you really continue the engagement once the partnerships are established? Remains a very tedious task, and like, we have our own priorities, they have their own priorities. So how do you keep the stakeholders really engaged becomes quite a challenge. Also, getting key speakers from the Ministry of Health from participating countries, like for example in Vietnam and Cambodia, while they were really interested to come on board, language barrier was really critical. So I think these are very interesting challenges and to have, and probably Dr. Rajesh Mehta would be able to really help us understand and really overcome some of these challenges, given that he has been continuously working in Southeast Asia. And then again, as I mentioned to you, getting city level COVID-19 vaccination data has really been a challenge. Thanks to our World in Data and whatever publicly available data sources we had, but then again, that was only the country level data which we had. Again, getting IRB approvals from different ethical committees, translation of tools in different international languages, transcription which is required. So I think, having been a part of this initiative, we were really able to understand these different challenges, and probably now we would have some more answers as we move ahead in this particular journey. Next. So what our experiences have been so far is that the initiative has been able to establish this particular platform which promotes collaborations across the global South. But then, as always happens, you always have some very strong countries or participants, and some of the countries you really have to put in more efforts. And also, again, I think there's a lot of engagement really depends on individual efforts from those particular countries or cities, and that's been a very similar experience. So through our private sector engagement workshop, I think the importance of private sector in health system strengthening really came up very strongly, and I think there are a lot of learnings which we can take from this particular thing into our routine health system strengthening work as well. And so private players like consultancy agencies like the Boston Consultancy Group, donor organizations, the research and manufacturing agencies as well. So there's a lot to learn from the private sector as well. So I think that was really interesting to come up with. And then we have, thanks to USAID, that they have a USAID COVID-19 working group and the COVID Action Collaborative as well. So I think it's all about collaboration and bringing together different partners. And there are so many interesting stories which we would not have been able to really find out unless we had actually spoken to our partners and really been able to bring them into our sessions as well, to share the amazing work which they have been doing. Next. So as we move ahead, as I mentioned that we've got a no-cost extension for this particular work, and we would be completing the research work, coming up with the coffee table book on the good practices based on the primary and secondary research as well. We've started a CoVLEx hashtag campaign for vaccination advocacy. Also, we are looking at developing AR/VR knowledge product as well, and we would soon be having a global event in which we want to have this particular AR/VR related product for everybody to experience how the entire vaccination story actually happened. Also, as I mentioned, we have developed a CoVLEx landing page, and we would be creating this knowledge repository, which we would make it available for everybody to actually go on that and download the material, read the material as well. We would be also conducting a few more learning exchange sessions as well as we move forward. And sometime in May, we are planning to organize a global learning event where we intend to bring all these countries together and have a hybrid sort of event where we would have in-person participation as well as a virtual participation as well, with active engagement of the Ministry of Health and our different stakeholders. Next. So this is about the global call to action event, which tentatively it's planned to happen sometime in early or mid-May, where we would synthesize and present the learnings from the 15 cities under the CoVLEx initiative. So this would be something sort of a culmination of the work which we did throughout this particular year. And then basically taking these learnings from COVID-19 vaccination to accelerate the universal immunization program as well. And also taking these learnings to create another learning exchange initiative on urban health under Samagra, where again we would actually engage with countries and cities from the global south to really look at health system strengthening in urban areas, and how can different stakeholders really come together to improve urban health outcomes. Next. So yeah, that's all from my side, and over to you, Dr. Vikram.
Ajit, I think that was an excellent rendition there, and very crisp summarization of the phenomenal work which Samagra team has done with the support of USAID and the partner nations. And it was an enriching experience for all of us to go through the extensive work. And also it was heartening to see that on similar lines like NQOCN communities of practice, which is focusing entirely initially on the point of care quality improvement methodology to drive a health system change. There's a similar initiative which has risen to the need of the hour, that is the vaccination hesitancy and improving the uptake of vaccination in underprivileged nations, I would say, with the help of the learning platform, which has been very innovative. Now, before I start, there have been multiple questions, I think, and there would be a lot more questions. I would take that privilege of wanting to know from you, because we've been, now close to 2.5 years, we've been operating the NQOCN communities of practice. And we have been trying to see what impact this communities of practice is having in terms of various objective, criteria or indicators. And we've been, brainstorming really and taking it forward amongst ourselves, and also trying to pen it down in case you want to publish it and share it with a global audience. So I would just like to know from you, for the sake of my own understanding, because the way forward which you mentioned in the last slide, at this point of time, it is not talking about any impact assessment. So is that a part of the original program document? If not, what could be some of the metrics which a learning platform like the specific learning platform which you have had, you would use what indicators to do the impact assessment of such a learning platform? I think that would be tremendously beneficial to the panelists and the participants of this communities of practice as well.
No, a very, very important and a very valid question, Dr. Vikram. So as far as CoVLEx is concerned, because right from the beginning, this was like we did not actually have any implementation on the ground. It was more about really looking at what is happening by the government or by different stakeholders, and really bringing those learnings and sharing them. So the matrix which we tried to follow in terms of really looking at what has been the reach, or the sessions which were conducted in terms of really sharing these experiences, and really looking at the number of best practices which have really come out, the knowledge tools which have actually come out. But to your question, I think given that NQOCN is not only about learning, but you are also implementing on the ground as well. So that actually becomes an additional part of your work. And I think impact really becomes important, and getting that to be able to measure and share really becomes important. And so, as we had discussed earlier as well, I think we would which can really be looked at. And when we really talk about impact, like for example, NQOCN, given the work which you are really trying to do, and that would probably be at a granular level in terms of through QI, what impact has it really had on reducing, say, the morbidities and mortalities related to different QI related work. So, for example, if you look at Laksha, how has the QI related work really been able to reduce morbidities and mortality due to, say, eclampsia or due to PPH, or for example, in terms of newborn, again, it could be regarding birth asphyxia, sepsis, and others as well. So I think this would be really important to really look at macro, meso, and micro level indicators in terms of the clinical interventions, and then there would be some indicators related to governance or processes as well. So I think it would be a mix and match of all that, and I think that would really be very interesting in terms of really making people aware. So I'll pause there.
So I think you've given us beautiful insights. We are in sync with what we ourselves have been thinking. Engagement of score per se, I think today only we were discussing about that in greater detail. But I would just like, on a different note, I would just like liking to know from you whether the learning, the Puritan or the pure learning management platforms, can they have some impact assessment scores or some indicators? Like, can a pure, online learning management platform, or maybe a communities of practice without any ground level implementation, have impact assessment done? Maybe to calculate the ROI, or how are we sure that what we are discussing is making any attitudinal shift?
No, so I think, yeah, so in the long term, there's definitely, I think, because for any impact to be measured or studied, I think 1 year is really a very, very small period where you actually can really show some impact. But I think for learning exchange or learning platforms, I think what is really critical is that based on the learnings which have happened, I think probably looking at what have the participants or the organizations really been able to take from those learnings and implement at their level. So I think if we can really look at that, probably that could be a way of really looking at the impact which a particular learning platform has had. Because, for example, if we have, say, a learning session around, say, prevent sepsis management or something, and we have, say, 5 SNCUs participate in that, and we have their base scores when they participated in that particular event, in terms of what the sepsis was, the incidence of sepsis or whatever was in their SNCUs. And following this particular learning session, what was the attribution because of the learnings, and what were those critical change ideas or something which they actually took from the learning sessions, which could be annotated within their run charts to really show that after this particular thing, there was some change. So I think it's all about attribution and really trying to link that to this, because this again becomes one of the change ideas in whatever work they are trying to do in their particular facilities. So I think that way probably a learning platform should be able to measure impact.
So thank you so much. I know that is a question which is very, it is very difficult to measure the impact, especially with short-term projects. And thank you so much for answering it beautifully. I think we've all been more enlightened with it. We have quick questions. Dr. Sushil, can you unmute yourself and ask your question, please?
Dr. Yeah, Sushil. Hello. Hi, yeah. Congratulations, Dr. Ajit. Excellent presentation. And sorry for my part, I had some emergency calls, missed a few portion of your talk. I just want to ask 2 or 3 important points. One, it has been a great pleasure to see the performance of Indian COVID vaccination as compared to vis-a-vis other countries. What would be, according to you, the single most important strength in our vaccination structure, which helped in COVID vaccination strategy, which our government adopted? And what one single lesson which you would like to tell our vaccinators or program managers who are involved in not only COVID vaccination for that matter, but other childhood vaccines, which are very, very critical in our country. So what important lesson to learn from this COVID vaccination? One single point, and what strength you think really added to our advantage in the COVID vaccination drive. Yeah, thank you.
Yeah, thanks, Dr. Sushil, for that question. So I think Dr. Sushil, I think a couple of things which really stood out very strongly in terms of India's COVID vaccination program was that probably, and here again, I would really like to mention the role the private sector really played. So I think one of the highlights of the COVID vaccination program in India would be the complementarity or the role which the private sector really played in really coming up with the COVID vaccines. So had India not had the capacity to develop our own vaccines, I think it would have been a completely different picture in terms of the number of deaths or the way the COVID pandemic really got handled. So I think developing our own vaccines and the way ICMR actually worked closely with Bharat Biotech to develop the vaccine, the way Serum Institute actually collaborated with partners outside of India to come up with vaccines. So I think having our own vaccines was very critical. So that was one. The other important thing was that the leadership, the engagement of the leadership. So our Honorable Prime Minister really led from the front. I think that brought in a lot of confidence in the vaccination program. And I think had the second wave really not been that bad, probably India would have been able to really provide more vaccines to other countries outside as well. And I think the way this entire planning actually went about in handling such a huge vaccination program, I think probably also taking learnings from our very own immunization program. So be it the Mission Indradhanush, the way it actually got implemented, I think India always had that confidence that we should be able to manage this mammoth task. So I think the political will, the political engagement leading from the front, the public-private partnerships which were there, and like India being called as the pharmacy to the world, I think these are some of the important things which India has brought in.
Thank you so
Thanks,
much.
Excellent. I was just thinking, could we have some app like COVID app for routine immunization for children too? Some way helping out and understanding city-wise fluctuation. And the last question was, you mentioned about challenges in individual city mapping up of vaccination. Was it a challenge in India too? Did the app didn't help much, or what was the problem?
Yeah, so I think CoVLEx is a great platform and a great application. Now, what has happened in CoVLEx is that you get district level data. Now, I think further work would be needed to actually, based on the COVID vaccination centers where they are located, you'll have to really do a GIS mapping to really understand the city limits and all that, and do some analysis to really get the city level information as well. Again, here we have really some excellent examples from outside of India as well, where probably some of you would have heard the name of Sergo Foundation. So I think Sergo Foundation has done an excellent job in terms of really looking at vaccination data in the US as well as in Kenya and some other countries, where they looked at vaccination data, mapped it in the different district regions and all that, to identify the areas where vaccine hesitancy is more as compared to other areas. And so they call it precision COVID-19 vaccination efforts. So I think we already have a lot of data available there. So I think the next level of work would actually be to really look at this, do this entire work and get some disaggregated data, and then try to see how it makes more sense.
Thank you. Thanks a lot, and best of luck for your team. Yeah.
Thank you. Thank you.
Thank you, Sushil, for that question. I think we're running out of our time. I would just allow one more question from Dr. Kedar. So I know there would be many more questions, but it has been a great session. So Dr. Kedar, your question, final one for this round today.
Yeah. Thank you, Dr. Vikram. Thank you, Dr. Sudke, for a nice and lucid presentation. What I would like to know is there any advantage of using tools like IHI conversation guide for vaccine uptake, considering the resistance or the hesitancy of vaccine uptake? Are any such experience in using these tools, or what is your opinion regarding such kind of tool?
No, so I'm actually not aware of this particular tool which you mentioned. I'll definitely go through it. But as I said, and Also, Dr. NK Arora has spoken about vaccine hesitancy a lot. So I think initially in India, there was a lot of challenge around vaccine hesitancy. And that's why I also mentioned about the work. So tools which can really help understand the geographical distribution of vaccine hesitancy, identifying those pockets and really trying to then come up with solutions to address the specific reasons of vaccine hesitancy. Would really help. Like, for example, what Sergo Foundation did in the US, or for that matter in Kenya as well. So they really try to understand the reasons for vaccine hesitancy, so we really cannot have a very generic approach. It has to be, we need to really go to that particular level to really identify what is that specific major cause for hesitancy in that particular area or region, or whatever, say a slum, and then try to address that. And so through different methods. So I think these tools definitely help. But I think so here data really plays a very important role. And unless we have that sort of a data analysis come out, we would really not be able to address that. Fortunately for India, I think there was a period where there was, we saw a lot of vaccine hesitancy, but then thanks to the efforts put in by different partners, say including UNICEF, WHO, and others, to really help the government in really addressing those hesitancy related issues. Like, for example, in tribal areas or in urban areas. So the way even professional bodies like NNF, IAP played a very critical role. The private sector played a very important role. And then again, we had politicians themselves coming up and getting vaccinated. So I think these lot of strategies were really work. But I think what lacked in India was that granular level of data to understand specific reasons for hesitancy, geography wise, was something which we really did not have. But fortunately, it really did not matter much as we progressed forward.
Thank you.
So thank you so much, Dr. Kedar, for that question. I think that gives us an input that we should all go through that conversation guide from IHI. And as Dr. Sudke has just completed an excellent session, I would just like to mention here, friends, that the need of the hour is to connect, network, share your experiences. And as has been very beautifully shown by this experience, the learning platform in the times of the pandemic, with the support of the USAID and the Population Council, I think Population Services International, I think it is very, very important that online learning systems like the communities of the practice, together coupled with on-ground implementation and impact assessment, to see whether these modalities are really making a difference. And again, very, very important, bringing together the nations along with multiple stakeholders and the experts under one umbrella. I think it is a phenomenal effort in times of pandemic. And I think the entire team, which was previously led by Dr. Rakesh Kumar, deserves a round of applause from all of us. And we are deeply grateful to you, Dr. Sudke, for sharing this today on the NQOCN Communities of Practice. And we hope to continue to learn from this and visit the webpage when it is ready, and also continue to see you diversify into the urban health mission. And we are very fortunate as NQOCN is a partner to the Urban Health Technical Working Group, which is notified by Government of India. And we're looking forward also with the NNF teams working together with your teams at Samagra to take forward the urban health agenda in the country. So thank you so much. Any last words or messages from you, Dr. Sudke, before we sign off?
So thank you, Dr. Vikram, for giving this opportunity. And yeah, so I think it was all the vision of Dr. Rakesh Kumar sir, and like under his guidance and leadership, we were able to put this together. Unfortunately, sir has now not with PSI. He's now gone back to the government in Uttarakhand as the chairman of the Uttarakhand Public Service Commission. But he always remains there to guide us and take this initiative forward. So we really look forward to work closely with NQOCN, the amazing work which you are trying to do. And let's see how best we can collaborate on the urban newborn as well, which we plan to start soon. So thank you, Dr. Vikram.
Thank you so much, and good night. Thank you so much, everybody. And